Good afternoon, folks. I have discussion B for you. Now, B, we're discussing senior falls due to prescription drugs. Okay, so here we go with the presentation I made for you. Please sit back and enjoy. The U.S. death rate from falls among adults age 65 plus has more than tripled since 1990, and experts link much of the rise to increased use of central nervous system prescription drugs, so called FRIDs. If you or an older family member lives in Meadville, start with a medication review at the UPMC Outpatient Center and ask about deprescribing and fall prevention services. Key facts and what they mean. Margin magnitude fall related deaths among Americans 65 plus more than tripled over 30 years. In 2023, there were 41,000 deaths in this age group. This trend is unique to the US compared with many other high-income countries, like likely driver. A leading hypothesis is is rising use of fall risks, increased drugs, FRIDs, including opioids, benzodiazepines, antidepressants, gabapentin, certain cardiac drugs, and anticoagulants, which can cause dizziness, drowsiness, and impaired balance. Debate. Some experts note improved death coding and greater survival with multi comorbidities may partly explain the rise. However, medication exposure is a modifiable risk clinicians can address. Practical steps to reduce fall risk. Actionable. Get a formal medication review with a primary care clinician or pharmacist. Request a FRID checklist and ask which drugs could be tapered or substituted. Bring a complete medication list, prescription OTC supplements with you to an appointment. Ask about deprescribing programs and the Beers criteria recommendations for safer alternatives. These programs exist nationally and are being promoted in geriatrics. Non-drug alternatives for insomnia, pain, or anxiety. Discuss CBT for insomnia, physical therapy for pain, strength, balance, and behavioral approaches before adding CNS active drugs. Local resource: Meadville UPMC Outpatient Center, 16039 Conneaut Lake Road, Meadville, PA. Ask for a geriatric or medication management appointment, physical therapy referral, or home safety evaluation. Quick guide for clinicians and families decision points. Which medications to prioritize for review: opioids, benzodiazepines, gabapentinoids, antidepressants, strong anticoagulants. when gradual tapering to avoid withdrawal